right, let's begin. So we are going to do confidentiality, right? Young patients, teenagers, how to manage. Because teenagers, what happens is they have got limited rights. They do not have all the rights. So that is the main topic, right? That we are going to discuss now. So first of all, we need to know age of consent in England. That's the main thing. What is the age of consent in England? It is 16. Age of consent is 16, right? Now, you have to remember a few things. These young patients, they have got limited rights. Young patient, I'm talking about under 16. So that is what we have to do is Gillick competency. So under age 16 to determine the capacity of an individual, what we do, we use Gillick competency, right? Okay, so now age of consent is 16. Now remember one thing, any sexual activity with somebody who is less than 13, will be considered as a sexual offense and must be reported to Children Protection Agency, right? Uh, this question you will see in other exams as well, maybe PLAB 1 as well, where you should be reporting it. It should be reported to Children Protection Agency. Are we going to involve the parents? It depends on the Children Protection Agency. If they wish to involve, they will be able to involve, right? So age of consent is 16. Any sexual activity with somebody less than 13 will be considered as sexual offense, must be reported to Children Protection Agency. 16 and more than that, they can give consent. Now, mainly now I'm going to talk about the age group 13, 14, and 15. What happens there, right? That's the main thing. For all these scenarios, ethical scenarios, just keep these 4 points in consideration. Number one, voice control. Make sure you are soft spoken, right? This is very important. Make sure you are very, very soft spoken. Number two, make sure you give proper eye contact to the patient. Many times you will see the patient might not be giving you the eye contact, but you make sure you are giving eye contact. You are able to find those non-verbal cues as well. And if you find, what you do, you acknowledge, and acknowledge. Then noting, what is it? I mean, if you see a patient is talking a lot, so of course we cannot interrupt the patient in between. So what you're going to do, you will nod your head just to make sure, just to show it to them, I am listening to you. I'm not going anywhere. I'm listening to you. So that is something that you can do. And keep distance. What I mean by that, so I mean, if you see this patient, because it's a patient who is maybe a victim of abuse, so they might not be very comfortable talking to you. They might be just sitting looking down. So they're not giving you proper eye contact. So what do? You may have to go a bit close to them so that they will feel more comfortable. Okay. So that is the meaning of these 4 points here. Yeah. Now, these young patients, less than 16, they have got limited rights. They don't have all the rights. So what I mean by that, they have got the right to opt in for the treatment. They don't have the right to opt out from the emergency treatment. What does it mean? Let me go in a bit detail. So, for example, you got a patient and patient is asking, patient is age is 14, and patient is saying, I want the contraception, I want emergency contraception. Why? Because I had unprotected sex with my boyfriend last night. Okay, so will you be able to give emergency contraception to her? I would say yes. You will check the criteria that I'm going to discuss now. You will also check if she's in an abusive relationship or not. But am I going to give the medicines? Am I going to give the emergency contraception? I would say yes, because she already had unprotected sex. So what you're going to do, definitely we will give the emergency contraception, but we need to see, are we going to report it or not, depending on these criteria that we're going to discuss. Right? So what happened is, patient can opt in for the treatment. So patient came to you asking for emergency contraception. Can I give? Yes, I can give. So patients can opt in for the treatment. They cannot opt out from the emergency treatment. What I mean by that? So on the other hand, if you have got a patient who is 14 years of age and having burst abdomen. Now, what's the treatment for burst abdomen? I think there's only one treatment, that is surgery. There's nothing else you can do. You have got to go for laparotomy, isn't it? You have to go for surgery. And this patient is refusing. This young patient is refusing the surgery. Now the question is, can they refuse the surgery? The answer is no. They do not have the right to refuse the life-saving treatment. That is the thing, right? So they can opt in, they cannot opt out from the emergency treatment. So what you will do in that case, when they're refusing the surgery, life-saving surgery, you will take consent from the parents, right? They will take the consent from the parents, and what you do the surgery. Now somebody asked me, if parents also refuse the surgery, will surgery happen? I would say yes. You have got the legal team as well in the hospital. So what you do, you keep them in the loop as well, involve them as well, and do what is in the best interest of the patient. So what is in the best interest of the patient? You do the surgery. So what you do the surgery. So young patients less than 16, they can opt in, they cannot opt out from the emergency treatment. Now, the thing is, we need to know about the Lord-Fraser criteria on contraception as well. So, can you give, you will give contraception to someone who has got the understanding. Now, I'm talking about the age group. I'm talking about the age group that is say less than 16. Yeah, I'm talking about less than 16. So if they're asking for contraception, will you be able to give it to them? Yes, if they have got the understanding, what is this contraception, what is the effect, side effect, and what is STI, what is pregnancy. If they understand that, of course, we can definitely give it to them. That's not a problem. Yeah, not be able to persuade her to inform the parents, right? You're not gonna force them to inform their parents, but we always encourage them. We always encourage them to speak to their parents, right? But again, it is only the wish of the patient. Yeah. And they're likely to continue sexual intercourse without contraception. And without contraception, she would suffer from mental or physical trauma. So what can happen? What can happen? So, what can happen is STI can happen. What can happen? Pregnancy can happen, right? So that is the main reason, right? So that is what the Fraser criteria is. So without contraception, they're going to end up in a lot of trouble. They'll have pregnancy, STI, so it's better to give them the contraception, right? And if it is in her best interest to give contraception, what do? You give contraception. That is it. Now, the contraception has been given, but now you need to check if they are in abusive relationship or not. So what are the things, what are the criteria suggestive of abusive relationship? So these are the criteria. Number one, if she is too immature to understand or give consent, if she is too immature. So when you're talking to as a clinician, when you're talking to the patient, you understood that the patient is not mature enough. Patient is immature to understand what is protected sex, what is condom, what is pregnancy, what is contraception. So patient is immature to understand or give consent. So that will be considered as abusive relationship. If there is big age gap, a maturity gap and power difference between her and the partner. So if there's a big age maturity and power difference, what you will be doing, you will be reporting it. You'll be reporting it to children protection agencies, right? And I'm talking about the age group that is 13, 14, and 15. Anything less than 13, what you do, you report it to children protection agency. And if the patient is 16, they can give consent. So you don't need to report it. Fine. But we're talking about 13, 14, 15. So if there's a big age gap between her and the partner, if there is a maturity gap, and if there's a power difference between her and the partner, what you're going to do, you will be considering that as abusive relationship and you report it to Children Protection Agency. If there is a position of trust, I mean, if the partner is, say, an instructor, teacher, any gym instructor, or anything at the position of trust, that will be considered as abusive relationship. If the relationship is non-consensual, if the relationship is forceful, and if there is any kind of addiction in the engagement of sexual activity, like the drugs, alcohol, that will be considered as abusive relationship. And if the sexual partner is somehow known to the police or children protection agency, that will be considered as a sexual offense, right? And it will be reported. So what you need to do when you get these patients, you need to talk about these criteria as well. You need to ask these questions. And the thing is, if, for example, you got a young girl coming to you, 14 years of age, and you're taking history, who's your partner? How did you come to know each other? And she's hesitant in answering those questions. She's not answering. What does it mean? There is something wrong. So if you've got any doubt while talking to these young patients, if you've got any doubt, there might be something wrong. What do? You need to involve a children protection agency. You need to involve your seniors. That's what you do, right? So, but if she's talking to you very comfortably, she's immature enough to answer all your questions, then it's fine. You do not need to complain. You do not need to report it to anywhere, right? But be very, very careful. Any doubt if you got, just report it. So what can happen? If there is any like abusive relationship, you will see in the OSCE scenarios what's going to happen. You will see lots of non-verbal cues. You will see patient is not comfortable talking to you. You will see patient is looking down, patient is very shaky. So all those non-verbal cues going to tell you that there is something wrong. There is something wrong. And when you ask who is the partner, what's the age, and they're very hesitant in answering. Obviously, you can offer confidentiality that it is confidential between you and the team until everyone is safe. But it is the time maybe you have to report it as well. Now you might be thinking, if the conversation is confidential, but you're reporting it to Children Protection Agency, am I breaching the confidentiality? Yes, that's okay. If there is a danger to the life of the patient or danger of life to anybody, we may have to breach the confidentiality as well, right? So that is the main point. Yeah. So this is what you need to do if you have got an young patient. Yeah. So you will get many scenarios. So in some scenarios you will see the parents are coming to you and asking about their young children. Will you be able to give them the information about their young children? The answer is not really, right? Let's discuss a bit about emergency contraception as well. So for example, a young girl came to you and asking for emergency contraception. So number one thing is, you will definitely be asking her those questions to see if she is in abusive relationship or not, and if she understands what is contraception and what can be the ill effects if you don't use the contraception. But once you have decided that I am going to give the contraception, then which contraception, which medication, which method of contraception is the best thing, right? First of all, emergency contraception can prevent pregnancy after unprotected sex or if your contraception method has failed. For example, a condom has split or you have missed a pill. So what we can do, we can use emergency contraception as well. Yeah. So there are two types of emergency contraception. Number one is emergency contraceptive pill, also known as morning after pill. And also we have got IUD, that is intrauterine device, that is a coil, a copper T. So these are the two methods that we have got for emergency contraception. You can ask the patient which one you want if the patient has come for emergency contraception. But you tell me which one patient will be more interested in. I would say I think the pill is very easy to take as well. Yeah. And the pill also, we have got two kinds of pill actually. Number one is Levanil, and then the second is Ela-1. Levanil has to be taken within 72 hours, within 3 days of unprotected sex, and the Ela-1 has to be taken within 120 hours, meaning 5 days of unprotected sex. But the thing is, take them as soon as possible. I mean, don't wait till 3 days or 5 days. For example, patient had unprotected sex last night. So, and if they have come to you now, tell them to take it now. Don't like wait for tomorrow or day after. Okay, I can take it within 3 days. Yes, you can. But if you take it as soon as possible, the success rate will be much, much higher. Because, whichever method for contraception you use, it is not 100% effective. It's not 100% effective. So use it as soon as possible. Yeah. And what happens is both the pills work by preventing or delaying the ovulation. Emergency contraception is best taken as soon as possible to be effective. Yeah. Now, IUD can be inserted into your uterus up to 5 days after unprotected sex or up to 5 days after the earliest time you could have ovulated. It may stop an egg from being fertilized or implanting in your womb. So simply, tablets can be taken within 3 or 5 days of unprotected sex, depending which one you're taking. Is it Levanil or Ela-1? Whereas IUD, copper T can be taken within 5 days of unprotected sex. That is the thing. Yeah. So this is the thing that you need to do. Fine. Now, what we have to do is emergency contraception. They does not protect against STI. Tell the patient. For example, patient has come for this emergency contraception. You agreed to give the tablet, that's fine. Tell the patient that this emergency contraception, number one, they are for the emergency purposes only. Don't use it for regular method of contraception. Number one. Number two, they are going to protect you from pregnancy, not from STI. So it's advisable to use barrier method as well. So this is a very important point. Make sure you do not miss it. Right? So these are the two slides, very, very important. Confidentiality, Lord Fraser criteria, and Gillick competency, and the criteria of abusive relationship, and what are the things that you have got for emergency contraception. Okay. Now, there are many scenarios you have got. For example, we have got a concerned mother or a concerned parent scenario. A mother is coming to you, mother is coming and wants to know about the daughter who is 14 years of age, 14-year-old patient. But mother has come to you asking if my daughter has come to you asking for contraception. So, whom you are talking to? You are talking to the mother. And they have asked, the mother is asking if my daughter, who is 14 years of age, if she has come to you asking for contraception or not. And it's very difficult sometimes to do these kinds of scenario. So, are you going to give that information to your patient, to the mother here about the daughter? The answer is no. You're not going to give that information. Why? Because it is confidential. Because it is confidential. So I'm going to give that information. The answer is no, no, no. But the mother will have lots of concerns. Mother is like, if my daughter, for example, if she is in relationship with somebody who is older than her, if she's in relationship with somebody who is like having any a position of trust, or maybe she end up having more into more trouble. She end up having a pregnancy. She end up having STI. So I'm worried. So how can you just give contraception to somebody who is 14 years of age? Then the thing is, you have to have the proper explanation. The thing is, number one thing is, you never give her the thing that we are talking about her girl. Make sure you never give an impression that I'm talking about your girl. In these kind of stations, you have to talk in general. You have to talk in general. What I mean by that, you tell the mother, you tell the parent that, see, mother, what's her name? Say, Maria. Maria, I'm not talking about your girl, but let me tell you, if somebody of your daughter's age, if somebody of your daughter's age come to us, what we do? If somebody of your daughter's age come to us asking for contraception, we ask them, who is the partner? How did you get to know about him? And if it is a consensual relationship, if it is a forceful relationship, if there is any kind of drugs, alcohol involved in it, and who is the partner and what she understands, from where she understood about emergency contraception, what she knows about pregnancy, what she knows about STI. And when we feel that the person is competent enough, patient has got competency, only then we give the contraception to them. Again, Maria, I'm not talking about your girl. I'm talking in general. If somebody of daughter's age come to us, this is what we do. And I'm really sorry, I'm not able to give you any information about your girl because this is confidential. I'm sorry, I was not of much help, but this is what we do. For example, Maria, if you come to us for any problem, and we will discuss it with you, but we will not be discussing it with anybody else because it's confidential. So the same thing, it happens, it applies to your it applies to the young patients as well. Because if we discuss, if without their consent, if we discuss it with others, if we discuss it with the parents, what's going to happen? They'll be quite hesitant in coming to us the next time. And if they don't come to us for help, what's going to happen? They're going to end up having pregnancy, they're going to end up having STI and other things. So this is how you can explain it to them. And what else you can do? You can take, you can encourage the mother. You can encourage the mother to speak to their daughter. That's something that you can do, right? Like talk to her, ask her, and I'm sure she will be able to tell you. Also, what you can do, you can take a bit more psychosocial history as well. Psychosocial history will be very important as well. I mean, who else is there in the family? Maybe this 14-year-old girl, she might be close to her father. Maybe she is more close to her elder sister. I don't know. So maybe you can go a bit more in detailing of that as well, right? So are we gonna tell anything to the mother about the daughter? No, no, no. But you need to explain the criterias. You need to explain the guidelines to her in a general way. Like if somebody of your daughter's age come to us, this is what we do. That's something that you need to do, right? On the other hand, for example, if a young girl, say 14-year-old, if she has come to you asking for emergency contraception, then what you are supposed to do? So what you're supposed to do is very simple. So first of all, why you need emergency contraception? Doctor, I had unprotected sex with my boyfriend. When? because I need to know if it is within 3 days, 5 days, so I can offer her proper contraception. Right now, in this station, if a young girl is coming to you asking for emergency contraception, so what you need to do, you need to ask all those ethical questions. Which ethical question? All these, just to see who is the partner and to see if she's in abusive relationship or not. So you ask all those ethical questions. So that is very, very important. Yeah. Plus, you need to ask lots of medical questions as well, right? Which medical question? I'm going to come to it. Now, in the ethical question, you can ask, like, you want emergency contraception because you had unprotected sex with your boyfriend last night. Okay, fine. Now, you need to ask, who is the partner? Who is the partner? What is the age of the partner? How you know each other, right? And if there is any drugs or alcohol, if the relationship is forceful or consensual. The thing is, if this patient is talking to you nicely and she's like, yeah, I mean, we are in the relationship for last 1 year, that's absolutely okay. And she's very confidently talking, then it's fine. From where you got to know that emergency contraceptions are there? Doctor, I read it in the school magazine. Okay, because in the school magazine and all, these information are given in proper detailing and all. So I got to know from the school magazine. Okay, that's fine. And is it the first time you had unprotected sex? Yes. Otherwise, doctor, we use condoms usually. Okay. So when she's talking about this information, what do you think? She's competent enough or not? It looks like yes, she is competent enough. Right. Now she's saying, I want emergency contraception pills. Okay, then we'll talk about the pills. If she says, I want something for emergency contraception, then you can keep both the things, like the pill and the copper-T in your list. But now we know we cannot give the copper T or the pills to everybody. There are some contraindications as well. For the coil, for example, if patient had, say, ectopic pregnancy, if the patient has STI, PID, so you might not be able to put the coil. So make sure you cover that thing in the history itself. Yeah. Another thing for the pills, which pills we're gonna give? The pills will have the progesterone. But the thing is, if patient has got any arterial disorder, for example, stroke or anything, so you may not be able to give the progesterone only pill as well, right? So just maybe 1, 2 question in the past medical history you can cover as well. Any female patient you're talking about, then please talk about P as well, PP questions. There are 5 P questions that you can ask. Am I going to ask all 5? Let's see. So what are these P questions? Number 1 is pregnancy. Number 2 is pills. Number 3 is periods. Number 4 is pap smear. And number 5 I can talk about is partner. Now, pregnancy, is it important for us to know? I know she's 14. Should we ask about the pregnancy? I think yes. And it's very important for us to know maybe she had a ectopic pregnancy. Then coil is not a good option, right? Pills, is it important or not? Yes, I need to know, like, if she's taking any regular method of contraception. And if she's not taking, you can ask, would you be interested in interested in knowing about regular method of contraception? Because emergency method of contraception is for emergency purpose, not for regular method of contraception, right? Then the periods. Do you think I should ask about the periods? I would say it is very, very important. It is the most important question that you will be having. When was your last menstrual period? And if this patient says, my last menstrual period, it was 6 weeks ago, do you think you can give her contraception? No, she's pregnant. So you have to be very, very, very careful on these things, right? So this P question is very important. Pap smear, are you going to ask? Definitely no, definitely no, definitely no. Because pap smear, it's a routine cervical screening that's done in the UK, but we start when? After 25 years only. What my patient age is? 14. So if you ask about pap smear, we will sound very foolish, isn't it? So I have to be very careful. And about the partner, should I ask about the partner? Obviously, I'm asking about the partner in the whole scenario. So when you're talking to a young girl, the thing is, you might be asking lots of questions that is ethical and lots of questions which are medical as well, right? And if you see she's confidently answering and not hiding anything, then it's okay. But if you've got any doubt that there might be something wrong, what you will do, you have to report it to the Children Protection Agency. But if she's in an abusive relationship, are you going to give her the pills or not? She already had unprotected sex and she's in an abusive relationship. Are you going to give her emergency contraceptive pills? I would say yes. Are you going to report it? Yes. So that's how it works. Now, when you give an emergency contraception, we give 1 dose of it, right? But the thing is, when the patient these pills, patient can have some side effects as well. What are the side effects I'm talking about? Patient might have nausea, vomiting as well. So if the patient vomits within 3 hours, if the patient vomits within 3 hours, we tell the patient to come back to us so we can give another dose of the emergency contraception, because it is otherwise not going to be effective. The patient vomited within 3 hours, tell the patient to come back so we can give you another dose of the thing, another dose of the contraception. Tell her any contraception that you're using, they are not 100% effective. So keep looking for your periods. If the periods are delayed, come back to us. We may be able to do a urine pregnancy test as well, and then we can take it from there. That's very important. And tell the patient to always use a barrier method, because this emergency contraception is going to protect you from pregnancy. But for STI, it's advisable to always use condoms, right? That is very, very, very important. Yeah. So what did we learn? We learned about these criterias and we learned about emergency contraception. So young patient, age of consent is 16. What happens in 13, 14, 15? Yeah. All right.